Okay, thank you. I'd like to call the Monday, June 1st, 2020 meeting of the Health Committee to order. We have all members except, all members present except member Wendt. We have minutes to approve from our May 4th, 2020 regular meeting. Do I have a motion to approve the minutes? Motion by Chung, second by Robustelli. Any additions or corrections? Okay, hearing none. All in favor? Raise your hand, please. Thank you. Any opposed? Okay, that passes. Do we have any members of the public?
We do not.
Ms. Rodriguez. Okay,
No, we
thank
don't.
you. Then moving on to departmental matters. First thing up is Michelle Welch and Jason Tabb from Adult and Juvenile Detention. We have their general reports. Shelley, did you want to say anything? Or Jason, did you want to say, we'll take one at a time. Shelley, did you want to say anything about your report or any comments that you would like to make?
No, I have nothing at this time.
I have nothing additional to add as well. I'll answer any questions.
Okay, anybody have any questions for either Shelley or Jason? Member Chung.
Thank you, Madam Chair. I saw that they are opening the jail again to visitors. Is that correct?
Yes. I don't
Okay.
know if Welch is going to answer, but yes, the sheriff did make a decision to open up visitation again. Yes.
So I guess my question is are you going to be changing any procedures that you have already had in place over the last couple months now that the visitors are allowed again? Thank you.
Do we have any members of the public?
As far as I know, they are just have figured out how to have each person clean down their area of the visitors before they leave.
We have their general report.
I don't think much else is changing that I've been told.
Shelley, did you want to say anything?
And I would like to add, I don't know who had, first of all, I can hear someone who might be watching this on YouTube or Facebook while being on the call, so that you might want to mute yourself. Member Chung, also, of course, in-person visitation really has never, once we opened up the new portion of the adult detention facility, is all by video anyway. So folks are not necessarily interacting with the people who live at the detention facility. It is all done by video, but we are taking extra precautions, like Ms. Welch said, to encourage the visitors to wipe down the equipment, and we will definitely have our custodial staff do some extra cleanings in that area as well. So I hope that answers your question.
Yes, thank you so much.
You're welcome.
Member Metzger, I think, jumped on. Did you turn your microphone on, Catherine?
I went off and came back on. I'm assuming it's still working.
Oh,
Good.
okay. All right. Thank you. Member Gordon,
I had just to follow up on Member Chung's question. Is there any either at least recommendation or perhaps requirement for visitors who come into the detention facility to be masked?
Yes, they are to be masked, and they need to bring their own masks. We unfortunately don't have enough to give out, but we are letting folks know that. I know that I can't verify this because I wasn't able to physically go there today, but signage should be visible to those visiting. We do that at the government center, for example, because we do have some hours of operation just to accept property tax payments in the front lobby, and we do post a sign that says you need to wear a mask. So we would do the same there.
Thank you. Appreciate the information.
Not a problem.
any other questions for either Shelley or Jason? Okay, thank you both. Next we have Jessica McKnight, the Health Department Administrator, and she is on the phone. So she has her monthly reports. So Jessica, if you had anything that you would like to say first, and then we can open it up for questions.
I don't have anything to add to the reports, but if you guys have any questions, I'll happily answer them.
Questions for Ms. McKnight? Mr. Gordon?
I noticed three things in particular. First of all, the report looks very complete. On page 13 in our packet, this is in one of the boxed sections on vital records. There's reference to providing birth certificates by mail from March 20th through the end of March and reevaluating at the end of March. I'm assuming that that is the most recent information. I'm just wondering if there have been any reevaluations, any results of those reevaluations that have been finalized. That's question number one.
Sure, we are still doing them mostly online. We have had a few individuals that have come into the office, but it's always something that's available. We just, for March and most of April, stuck with just doing online.
Okay, thank you very much. On the next page in our packet, the communication from Kim Anderson to Carla Pohl at the Board of Health and the members of the Board of Health. I wanted to comment very favorably and positively on the account of the family case management illustration, the story involving a family from India that went back to India and then couldn't get back here, and the help that was rendered to that family, particularly, I gather, the mother in that family, who was very upset with the difficulties with a young child born with congenital cardiac issues, and the problems that she encountered, perhaps the problems she was anticipating, and the care that was extended basically by phone, I gather, or by Skype or something, but the ability to calm the person down from this distance. And under these circumstances, I wanted to really compliment the staff at the health department in the Maternal and Child Health Services Division, who were able to do the good work that was done. And I just wanted to say that for the record. And in case I almost missed it, I passed by it on my first pass through the packet today. And if anybody else didn't see that, I wanted to call it to your attention and call it to the public's attention too. A tremendously good example of what government can do in a very positive way and to the benefit of the people we serve.
Mr. Robustelli?
Jessica, one of the things I want to talk to you about is a follow-up to the email I sent to you and to Camille and Dion regarding sort of thinking out of the box and around how to reach different constituencies for testing. And so really it's a marketing question. So I wonder if, just from a process standpoint, you could share a little bit about, expand on how you're approaching marketing, given that our testing center now has been extended. We don't have the limitations we had before, yet we're seeing far fewer people take advantage of it. And if you would share a little bit about that, I just have a couple specific ideas and questions about tools that might be useful as well. So I'll stop, and then if Susan will let me, I'll ask just one or two more questions.
Sure. So I've been working with Dion, our communications specialist, and he has submitted a really kind of an ad campaign, if you will, for the testing site specifically. And our number one area that we're looking at is Google Business. To be able to, we've got information from our website that shows when people are searching for us or get to our website, what are some of those most common words that they're using. So if we can use those to then target our Google Business ads to really hit up people who are looking for testing and be that place that pops up. And then, in also working with Reditus, the lab that's out there at the testing site, just what ways can we continue to promote that the site is there, what the criteria is, and also, working with them again in our continuation of getting more testing to the area. And so they've got some things that the way that you can even register online before you go to the testing site, and that on that site you can type in your zip code and find available testing near you and register that. So looking at some of those things, and obviously social media marketing, we've been doing some Facebook ads, and really trying to explore a little bit, like you said, out of the box. So not your just typical radio and TV, but what are some ways we can get some targeted information? But I'm interested to hear what your other ideas are as well.
Well, I'm really glad to hear that you're thinking sort of some of the digital buys, and I wouldn't say that I hope we're looking at doing some paid marketing as well on the radio, and in some of the more traditional ways. I think there are a few things. One is, I think there's an opportunity here. There's a lot of people that want to volunteer and to support the work of the health department, and they have particular skill sets. And I think we've always looked at that through the lens of having a particular skill set in the healthcare field, like the medical brigade. But I think we should think differently about that. I think Dion can do a fabulous job of pulling together virtually a group of marketing and communication experts in our community who can help sort of push some of these out of the box ideas, and are influencers themselves. So in social media space, influencers sort of make all the difference, right? They're the people that are able to connect because they have a steady presence on social media. And actually, Illinois State has a social media lab that you could actually go there, and they could help you identify the top 25 social media influencers in McLean County. And those are the people you want to work with. Those are the people that can connect with the most people locally, and spread information for free. So I think a volunteer group is one thing I'd like to encourage you to think about, and be very happy to identify potential people in the community who I think would jump on this. The other thing I think, if you aren't already doing, is leveraging the ways in which people get information already. So for example, I work at Illinois Wesleyan. I'm sure our HR department would send an email to all staff that would give some information about the testing center. Maybe we could do that with State Farm, maybe we could do that with Country, maybe we could do that at Illinois State. That hits a lot of people in our community. And so I wonder if there are opportunities there to sort of share information that pushes hours and the operational things. And then the last tool I think that I haven't seen the health department plug into, but the municipalities use it quite a bit, is something called Nextdoor. And Nextdoor is like the Facebook for neighborhoods. So it's very neighborhood based. And I know the Bloomington Police Department uses it occasionally, but it's a really interesting and valuable tool for sharing information. So those are just some of the ideas that I have. I mean, I know you got a lot on your plate, but it seems to me that for us to be successful at this mitigation stage, when we see so many people now, I mean, more and more people are going to be going out and shopping. We've seen a lot of people come together in gatherings. At the same time, we're seeing our testing numbers in the 70s, which is far too low. We know that. So I think we're going to have to aggressively push the marketing and communications to get more people tested.
Yes, this is definitely going to be one of the key areas that, especially Dion and I, as we work through this next week, we're going to focus on. Is we want this testing site to be a success, and we want it to stay around.
And I know a lot of people that aren't plugged into social media, or even on that Nextdoor app too, that they're just not into any of that kind of thing. So I guess how do we reach those kind of people that maybe don't listen to the radio too much, or watch TV too much? I don't know what we've got going on there. So got to think of ways to reach them. So anyone else have any questions for Ms. McKnight? Hearing none. Thank you very much. Next, we have Camille Rodriguez and Cassie Taylor reporting for the nursing home. There's an item for action Request approval of a nursing facility hospice services agreement with Carl Foundation Hospital. And can I have a motion for that, please? Motion by Robustelli, second by Martin. Is this because of the change from advocate to Carl? Is that all this is?
Yes, Chairman. It is only because of the change in the ownership. None of the other requirements or content of the contract has changed. They just needed to update it to show the change in ownership.
Anybody else have any questions about this item? Mr. Gordon?
Thank you, Madam Chairman. I'm assuming that this is probably not significant, but I noticed on pages 26, pardon me, on pages 26 through 40, at the bottom of each page, there is reference to October of 2018. I assume that this is a boilerplate type of agreement that Carl has used to enter into agreements with other nursing homes, and that the date is simply the date that it was first formulated, that Carl signed off on it from their end, and we go forward from there. Is that a safe assumption?
Member Gordon, it must be. I missed that when we reviewed it briefly, so I certainly can reach out to my contacts there, but I'm going to make that assumption that it's boilerplate.
And I indicated at the start of my question about it that it probably isn't significant, but I did notice it and I just wanted to check it. It's probably not out of order, and I hope the question wasn't either. Thank you very much.
Oh, no worries. Thank you.
Anything else? Is everyone in favor then? Raise your hand, please. Any opposed? All right, and that passes. Next is items for information. There's the monthly report, and if the committee would allow to have item D2B moved up to also to C2B. So, because it's all about the nursing home. So let's just kind of keep the nursing home together. That's okay with everyone.
Thank you.
So if there's any questions on the monthly report. Okay. And so then we have the administrator. Oh, sorry, I didn't see you there. Okay. Member Chung.
Sorry, I got in there kind of late. But thank you. I had seen that the governor is requiring now employees and residents of nursing homes to be tested now, because I saw a story about how the other local nursing facilities were kind of scrambling to get these tests. I guess is there a plan for our nursing home to do this? Do we have enough tests? I guess if I can have any information about that, that'd be great. Thank you.
Thank you. Thank you, Member Chung. We're going to have all hands on deck to answer the question, as Ms. McKnight from the health department has also been involved in conversations. You won't be surprised that she's been a tremendous resource for many of the long-term care facilities in our area. And they've also been calling me saying, what is McLean County going to do? So we are seen as a leader in this as well. And I will briefly state, and Ms. McKnight can expound, and Ms. Taylor as well. Our plan is to find out how we will do this, because the Illinois Department of Public Health, at least as of about 11 o'clock this morning when I was talking with staff, they don't have any tests for us. So we would essentially have to regroup and try to, I think it's unrealistic to take residents of the facility to the testing site when they are supposed to be inside the facility. So I can have Ms. McKnight talk about any other additions she has. We are still working this out, and we are working regularly in discussions with other long-term care facilities we're all in the same boat with this. And so when the mandate was announced, there also was not a plan for us as to how we would even get access to testing. So Ms. McKnight, do you have anything to add to what I shared?
Sure. So we're planning to have a call with all of the local long-term care facilities, hopefully by the end of this week. I know they're on a deadline for the end of next week to have their plans written out and in place. With the CDC guidelines for the testing at long-term care facilities, right now it's if you've had a case, then they suggest that everybody in the facility, all residents and all staff, are tested. But I think they're also wanting them to have a plan in place to be able to weekly test all staff when you are in an area of high community transmission, which we currently, in talking with our communicable disease supervisor, we're not necessarily in that environment. However, again, need to be looking to plan for how we're going to be able to test those individuals weekly when we need to. So, I've been speaking with the Reditus lab, but then, also looking at other labs that IDPH has recommended for facilities. It's just making those connections of getting those things in place at the facilities that still do need them. And that's where we're gonna come in and hopefully be able to help connect the facilities with those labs so that they have the ability in-house, like Ms. Rodriguez said, to not have to take people outside of the facility. We want them to be able to do the tests internally.
Any other
So,
questions?
yeah.
Or you want to expand some more on what's going on?
I was not going to expand more, just to reiterate that, like all the rest of the long-term care facilities, we're working on our plan, but we wanted to join with them so that we were united in some of our approaches, especially for obtaining resources.
Mr. Obestelli.
So in the past, when we've talked about this in this committee, or at least I've been talking about it in the committee, the issue was a human resource issue in terms of being able to report to duty if staff had been testing. So are we changing that practice, or how are we going to work around that issue that was presented in prior months?
One of the ways is to identify, I know one of the labs that I've been speaking with can have results turn around in 16 to 24 hours. So trying to speed that up is one of the biggest ways, and it is something that IDPH had recommended, is to find a way to have short turnaround for results.
Yeah.
Any other questions?
Sorry, go ahead. I think Member Metzger has a question.
I don't have a question related to that at all. On the top of page 43, I wanted to commend the work that's been done, and I appreciate the updates that are on 42 and 43, but especially on 43, that we're looking at a lot of different areas. And most importantly is to move the payroll dates of the nursing home staff to the same payroll dates of all McLean County employees. I think that is going to make the reporting of this so much better. And I wanted to commend someone, whoever that might be, for looking at these things.
Thank Ms. Taylor and and Ms. Dreyer and our Human Resource Manager, Michelle Butler, for that. Just took action, working with Ms. McNeil's staff as well to get that done.
Okay, any other questions? Did you want to talk about the administrator update?
Yeah, that's good news, isn't it? So we're pleased that we, after an extensive search, we have extended an offer, and it was accepted for the nursing home administrator position, almost right on time for what we had expected in filling that leadership spot. That individual and their credentials are detailed in your monthly report that we provided to you. They will be joining us here in a couple of 3 weeks. I know that you should know, and we have shared with you, that Ms. Taylor is spending a significant amount of time at the nursing home, and she will continue on even after the new nursing home administrator starts to do some transition work. But I'm certain Ms. Taylor will also be looking forward to coming back to county administration. Although I will say she reports so much progress in building relationships with staff out at the nursing home. So it's not that she doesn't enjoy it. It's just hard to do both things and to juggle all of that. So in all, we're very pleased and excited about this. Some of the details I provided in my report regarding what this individual has done in other jobs as far as being a change agent, I think is what we are looking forward to, obviously. So we're happy to report that we filled the position.
Thank you. Any questions for Ms. Rodriguez or Ms. Taylor regarding the nursing home? And welcome, Mr. Wendt. Mr. Gordon.
Thank you. Thank you.
Thank you, Madam Chairman. This isn't a question so much as a comment on the financial data that we find on page 45 in our packets. I couldn't help noticing that in the first 4 months, January through April of 2020, the nursing home was running 280,000 plus ahead. Revenues were ahead of expenditures by that amount. And that is, I'm interested in it, obviously, for the numbers themselves, and was trying to think of the reasons that might feed into that, and I'm wondering if someone might enlighten me on that.
At least, I don't know if Ms. Taylor can elaborate better than I. Shall I put you on the spot, Ms. Taylor? If not, I will say that some of it is the diligence that you expected from staff in going after accounts and in sort of making right whether or not an account was a private pay versus Medicaid and tracking. So some of it is just a diligence to some of the things that we had been working on since late last fall, and you're seeing some of it come to pass at this point. I don't have Ms. Dreyer live on. I don't believe she is listening through YouTube and Facebook. So Ms. Taylor, is there anything else I'm forgetting regarding some of that increase that we're seeing?
I would just point out that earlier in the year, we did have staff, Rhonda Heflin, come to the committee and explain her work in cleaning up our books and looking to make sure that our revenue for our receivables was accurate. And I think we are now seeing the efforts coming to fruition, and hopefully this is a trend that we'll see in the future. I do know that staff that I have talked to are greatly appreciative of administration by Administrator Rodriguez and the allowing of multiple county administration, HR staff to assist them in some things that they have been wanting to do for a while. So we're seeing positive trends.
Thank you very much. And you're not alone in being glad to see it.
Yes.
By any stretch. Thanks.
Thank you. Thank you.
Thank you. Anyone else have any comments or questions regarding the nursing home? Okay, moving on. We have the report of the county administrator, Ms. Rodriguez. We have an item for action, which is request approval of a critical hire request, which is on page 48 of our packet. Is there a motion? Motion by Chung, second by Gordon. Did you want to, Ms. Taylor, you want to elaborate, or Ms. Rodriguez? Ms. Taylor's out there all the time, so.
Yeah. And activities are particularly challenging at this point because we can't convene in the activities room. So it's very important for us to fill this position and to have someone who can think outside of the box in filling activities. But Ms. Taylor, do you have anything to add?
So we had a hire that left after just a few short weeks, and I believe that the environment that we are in right now with COVID might have led to that departure, but I can't say for sure. I do know that this position will assist with a lot of the morale and the mental health of our residents, which I think is especially important in this time of COVID when they can't see people face to face. And so I ask that we be allowed to fill it.
Questions, comments? Okay, hearing none. All in favor? Raise your hand, please. Any opposed? Nope. Okay, that passes. Back to you, Ms.
Thank you. After that, Chairman Schaefer, I have just item D2A, which is my report on recent employment activities. So if you all have any questions about that, I'd be happy to answer. It's
Are
on
there any
page-
questions for Ms. Rodriguez? Okay, hearing none, we will move on to other business or communication. Our next meeting is July 6th. Anybody have anything else they want to add for under other business or communications? If not, we have bills to pay, and I have received the information. The auditors reviewed them and certified they comply with all of our ordinances and policies. So with that, the Board of Health has a prepaid total of $204,670.32. Motion by Metzger, second by Chung. All in favor? Any opposed? Okay, that one passes. Jail and JDC Medical have a prepaid total of $49,924.36. Motion by Gordon, second by Robustelli. And all in favor? Okay, any opposed? That motion passes there too. Developmental Disability Board has prepaid total of $113,686.94. Motion by Martin, second by Robustelli. All in favor? Okay, any opposed? Motion passes. And the nursing home has a prepaid total of $156,666.70. Motion by Chung, second by Metzger. All in favor? Any opposed? Okay, that one passes too. With that, I believe we are adjourned. Thank you and stay safe, please.
Thank you.